Welcome to The Heart of Health Live. There's a place for modern medicine in your life. Learn to use it correctly by getting your toughest questions answered on today's broadcast. Discover modern medicine's strengths and weaknesses. Lifestyle medicine opens the door to optimum health and healing. How you live and what you eat can profoundly affect mind and body. Learn simple solutions to complex problems. God provides the ultimate healing we all desire. He wants us healthy and happy. We just need to understand His plan for our lives and live accordingly. And now, live from Studio 1A in Chattanooga, Tennessee, here's your Heart of Health host, Dr. James Marcum.
Welcome, welcome. I'm glad you all join us on Heart of Health Live, where you are the program. And we have an exciting guest here, Dr. Wender. I have the privilege of working with him. He's a general surgeon and he does much more than that. He's more than willing. He's giving us time to answer your questions. And don't be shy. Get a hold of us. 855-644-3278 is our number. Minimally invasive, laparoscopic, robotic, scalpel, anesthesia, pre-op, blood. These are all words we use when we talk about surgery and surgical procedures. Many of you out there have had different types of surgical procedures. Last time Dr. Wender was here, some of you wrote in with questions to our website at heartwiseministries.org. Some of you have joined us on Facebook. Well, we want to answer your questions. We're going to give you a great answer today about your surgical questions. Now, on Heart of Health, there's no gimmicks, no fads. We're not selling anything. We won't even send you a bill. We just want to help serve you today. We also don't want you to have surgery. And the way we do that is by living a healthy lifestyle, eating good foods, exercising. And what we like to emphasize on Heart of Health, we also think it's important that you have a relationship with the Creator that gives you the power to see truth, that gives you the power to make little changes in your life so you feel better and you might not need surgery. So get on the phone right now, 855-644-3278. Our operators are standing by waiting to take your call. And if you call in quick, we're sure you're going to get on the air with Dr. Wender. Dr. Wender practices and sees patients every day. He actually did 2 surgeries today, and he'll probably tell you a little bit that as we go. So stay with us. I'm going to introduce Dr. Wender once again after this short breath. You're watching Heart of Health Live.
The Heart of Health Live will return in just a moment.
The Heart of Health Live is brought to you by Heartwise Ministries.
Hello, I'm Dr. Tim Jennings with your Mental Health Minutes. Are you pregnant or thinking of becoming pregnant? Do you want to ensure your child will have the healthiest brain possible? Then avoid all alcohol, because as little as 1 glass of wine per week alters brain development and is associated with behavior and emotion problems. Avoid smoking. Children born to mothers who smoked had higher rates of learning and behavior problems and psychotic disorders. Take omega-3 fatty acids. Omega-3s promote healthy brains and higher IQ. And watch out for depression. Untreated depression is associated with delayed fetal growth and altered brain development. However, antidepressants can increase miscarriage rates, contribute to smaller fetal heads, and slow growth in the newborn. If depressed, consider transcranial magnetic stimulation, the only FDA-cleared, drug-free treatment for depression with no risk to the fetus. To be smart requires a healthy brain, so be smart, do right, and make your child bright.
To learn more about mental health, visit comeandreason.com.
My life is full of statistics. Thing is, I could have dropped out of school and become one myself, but I didn't, because I had people that believed in me. Here's another statistic. 7,000 students drop out every school day. That's 1 every 26 seconds. It's time that students know that we believe in them.
Inspire a student and share your message of support at boostup.org.
I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. take the time and go to heartwiseministries.org.
Medicines That Kill from cardiologist Dr. James Marcum is now available. In his newest book, Dr. Marcum explains why he believes that medications may very well be the #1 cause of death in America. Medicines That Kill uncovers the hidden risks associated with modern pharmaceuticals and outlines the biblical plan for physical and spiritual health. To find out how to get your copy, visit our website at heartwiseministries.org or call us toll-free at 855-644-3278.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
We're glad you joined us, and if you just picked up the telephone, we want you to give us a call, 855-644-3278. We're live with Dr. Eston Wender. He's a surgeon. Dr. Wender, thanks for joining us.
Thanks for having me.
Tell us what you do today.
I got up, took the kids to school, and then I went to work and did a few gallbladders and got to do charts, which is always a good time.
Okay. Now, what's the most common surgery? That's one of the questions that came over our website for you is what's the most common surgery do you think a general surgeon or you do on a regular basis?
I would say the top two would be hernias and gallbladders.
Okay. Now, for those that don't know what a gallbladder is, how would you know if you had gallbladder problems?
Well, the typical way is, if you're eating a fatty meal or sometimes a Mexican meal, something spicy, 20 to 30 minutes afterwards you start noticing some discomfort in your upper abdomen and your right upper side. Mm-hmm. Sometimes you get nauseated, sometimes you feel bloated, sometimes you get chills and sweats, and you may get all those symptoms or you may just get one or two. But you may notice it only happens once a month, and then it's happening once a week, and then it's happening every other day.
Now, if you ignore this, could something bad happen?
It could, yes. You could get very sick, and you could get what we call septic and turn yellow, and it can lead to a lot of problems.
Okay. So a person has this stuff, comes in, you say they have the bad gallbladder. How did you take the gallbladders out today?
Do it laparoscopically. Typically put 4 holes in the belly and use the camera and what you would call, like you said earlier, minimally invasive surgery.
So for people that don't understand it, that's not cutting with the scalpel.
That's correct.
So there's just little holes?
Just little holes, yes.
Now, how long have this type of surgery been around?
Well, first started doing laparoscopy with gynecologists.
Okay. And
then back in the mid-late 80s, they started saying, hey, what else can we use this technology for? And then that's when one thing they saw the use for was gallbladder disease. They went from doing big incisions, as I'm sure some of your viewers have, to, hey, now I got 4 little holes and I get to go home the same day instead of being in the hospital for 2, 3, 4, 5 days.
So do you ever use scalpels when you take out a gallbladder anymore?
Rarely. That's when they're bad. That's when the person has waited forever and ever finally comes in.
Then you do the old-fashioned way.
Old-fashioned way.
Now you said you did some hernias today. Exactly what is a hernia? A lot of people don't understand what a hernia is.
For a general purpose, it's a hole.
Okay.
A hole usually in your belly in the middle or in your groins, but technically the word means to rupture.
Okay. Okay, so when you fix one of those, I guess you close up the hole?
You do, and depending on how big the hole is, sometimes you can just use regular sutures. Other times when the hole gets bigger or you've tried to fix it before sutures and that has failed, you use something called a piece of mesh, or other people may call it a screen.
I have a lot of people that call in, they want to do things natural, okay? Mm-hmm. And I think modern medicine, especially surgery, is one thing that's so crucial to the use of modern medicine, because before people had surgery, people with gallbladder surgery died.
Right.
And people that had hernias had bad complications.
Yes.
So this is a great use of modern medicine.
Yes.
Now, what got you interested on becoming a surgeon?
Several factors. My mother was big in the health field and did all kinds of interesting stuff, working in the ER, being a helicopter ambulance nurse. So you get to hear the stories. Mm-hmm. And I had very charismatic, outgoing parents and grandparents, and big in the church, and the whole idea of helping people and kind of fit.
Yeah. So now what kind of training? I know you go to medical school. How many years afterwards do you have to learn before you get to go out on your own?
Typically for general surgery it's 5 years, and then if you do any type of specialty on top of that, it's anywhere from 1 to 3 years more.
Okay. Now once you got out, is it what you thought it would be, or is it different?
The part that I love, it's what I thought it would be, taking care of patients.
Right.
The as you know, the filing of papers and signing this and signing that and dealing with other non-patient issues is much less fun.
Yeah. Well, someone out there might have a surgical question. We want to give you a chance to give us a call. The phone lines are still open. It's 855-644-3278. And Dr. Wender will try to answer any question you have about surgery. And I'll be happy to help out with the medical parts. We just want to serve you. And sometimes we have had questions come onto our website or email. We'll certainly answer those as well. Everyone has different questions about surgery. Now, when a patient comes into you, I guess they come either referred or they come usually referred. So they sort of know which direction they're heading, right?
Typically, yes. Typically, they've seen another physician or provider who has said, "I think it's this," or they've had a test that showed X, Y, or Z diagnosis. And so, typically, most people have an idea of what they have. Now, how we have to go about fixing it, that's something they typically do not know.
So one of the questions we had, I think this is a good question to ask right up front, is this person says, I'm going to have an elective surgery in the near future. Are there some things I can do to have a more successful surgery?
Sure.
So, I mean, what are some things they can do to make their surgery more successful?
Well, several things. One, make sure you're eating healthy meals, especially protein.
Okay.
You want the protein to help you heal, help you fight infection. Vitamin C. It's very good. Zinc, those things are good healers. So you want to have your levels up. You know, if you smoke, try to quit. If you're diabetic, try to keep that sugar in line. Try to stay active.
Okay.
Make sure those legs are moving, the blood's pumping. You decrease your chance of getting blood clots. And after that, it's...
Now, one of the questions that we've had come in a few times is about giving themselves their own blood should they need it. Do you usually do that?
I don't typically. Most of my surgeries don't require receiving blood.
Okay.
I mean, if it happens, it's not very common. But there are surgeries, back surgeries, I think is one. They'll usually have them go give their blood. And that may not be a bad idea to do it several weeks out so then your body has time to catch back up, but to have two or three units available if needed.
Okay, so food, special vitamins, exercise, don't smoke cigarettes. Now, occasionally, do they ever have to have like a general physical before they have this done?
Absolutely.
You know, because occasionally people have other health problems that might not be detected.
Correct. Yes, especially for the patients where blood pressure changes may occur suddenly, and they already have, when I see vascular patients, for instance,
right.
Typically if you have vascular problems in one place, there's a very good chance you have vascular problems in your heart, in your neck, or if it's in your neck, maybe in your legs. So patients like that, I will typically send them to the cardiologist to have them looked at to make sure that something doesn't arise suddenly while I'm in the middle of surgery.
Yeah, and I think that's great because occasionally I've had surgeons I've followed the patients and it's not your type of surgeons but other type of surgeons, they say, whoops, I didn't know they had a lung problem or a bad heart problem, and then they've had the surgery done and it sort of makes it a lot more complicated to take care of.
Yes.
So there's lots of things we can do. Okay, another question that we've had also says, what are some of the most common surgical complications? Now, no one likes to talk about complications, but
Sure.
What are some of the complications that we sometimes see in surgery?
I would say the most common one you see would be infection. I mean, anytime you're violating the skin, which is actually your most important infectious disease organ. I mean, you think, oh no, it's your white blood cells, but it's actually your skin. And so anytime you're cutting the skin, you're giving the bacteria a place to get in. Bleeding.
Okay.
And then depending on what you're doing, there's always risk of having a heart attack, having a stroke, getting a blood clot. Anytime you put to sleep, you have a chance for getting pneumonia. And then specifically where you are in the body, if you're working around the lung, you could puncture the lung and have a problem with your lung. Like I said, you could get blood clots if you're not up walking after surgery, or especially if you have a cancer type surgery. Cancer automatically increases your ability to make blood clots. But I would say infection and bleeding are probably the two biggest ones that I seem to counsel my patients about every surgery I do.
Yeah. Now, there's many people out there that might want to know how to pick a surgeon. We have some questions about how to find a good surgeon, how to ask the right questions, because sometimes you don't know if the person that you're going to is right for you. We're going to talk about that and also answer your questions. Give us a call, 855-644-3278. You're watching The Heart of Health Live. We're here with Dr. Eston Wender. We'll be right back.
The Heart of Health Live will return in just a moment.
I'd like to think that one day, when we get to heaven, we're going to see a list of people like Jared and Susan, who were introduced to Jesus because of something we said, or maybe it was as simple as a passing smile. But these people will look into their past and be able to say, I'm here because of you. Recently, you may have heard that Heartwise Ministries has begun spreading the gospel to the young, the old, the sick, and the healthy using this very television program, but we need your help. We want to take this type of medical programming to the non-believer and the person who has closed themselves off to traditional forms of outreach. If you believe as we do and want to support Heartwise so that together we can count more names on the Tree of Life, please consider donating today at heartwiseministries.org. That's heartwiseministries.org.
Wow, these are really good.
You act surprised. Practice makes perfect.
You don't have to be perfect to be a perfect parent. There are thousands of teens in foster care who don't need perfection. They need you.
Break away from the noise of life and spend time communing with God with the Celebration Cup 30-day devotional set. For just $18.97, you'll receive 30 pre-filled communion cups, a 30-day scripture calendar, along with a daily devotional. Celebrate communion in the privacy of your home or office. Are you ready to put the powerful blood to work in your life? Call 866-367-2877. That's 866-367-2877.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
We're here with Dr. Eston Wender. He's a general surgeon, and we have the calls coming in. And Jeff, you're on with Dr. Wender. Go ahead, Jeff. You there? Jeff, going once. Jeff, going twice. Okay.
Hello? Hello?
Oh, go ahead. You're on with Dr. Wender. Go ahead with your question. I think I got your name wrong. What's your name?
You definitely got my name because I'm a woman. My name is Monica.
I got it wrong, Monica. I was calling you Jeff. Go ahead, Monica.
Hi. I have a question about the gallbladder. I had gallbladder surgery about 20 years ago. I had 3 tiny little pebbles, and they took my gallbladder. Now, the doctors tell you, what happens about the fats and the salts and how they form, but they don't tell you what now happens to my body that I do not have that organ to process those fats. So I want to know what are the complications and what can a person do that has had that surgery no longer has a gallbladder, especially since I'm a vegan vegetarian, but I still seem to have problems with processing fats.
Yes, that's a very good question because there's millions of you out there that don't have your gallbladder. Typically, what all your gallbladders, your big job of your gallbladder is to store bile in between meals so that when you eat, especially fatty meals and some protein, that your body releases this bile to help mix with the food to help it break down so your body can break it down easier. So what happens in our diets is that we typically don't always get a good balance, and without teaching you a lot of chemistry with the gallbladder, there's a little triangle of fats and lipids and phospholipids that have to be in order anyways. Then if not, then stones form. And so your gallbladder's not there anymore, so your liver is still making the bile and it's still getting into your intestine. It's just not getting into your intestine the same way that God made it, as far as a big bolus or a large amount at one time. So you should not make any more stones. And ideally what you want to do is, it sounds like you're probably already doing it with your diet, is just keep it down with the fats and the triglycerides and eat a nice balanced diet. And that you should be fine. Now, unfortunately, some people can have digestive problems after having the gallbladder out. And it can change the way you go to the bathroom as well. And unfortunately, there's medications we can try, but there's unfortunately no one good fix.
Change the way you go to the restroom in what way?
You may find that you may be going more often or after you eat.
Oh, okay.
Not bad, it just may not be what you want.
Okay.
Okay.
Well, thank you. I really appreciate you answering my question.
You're welcome,
Thank you,
Monica.
You know, that's a good question, because lots of people have their gallbladder out, and you always have to say, well, what's the risk of leaving it in and the risk of taking it out? The risk of leaving it in is, of course, of sepsis and damage and dying, so you sort of have to do it.
Yeah, I think the benefit of the surgery outweighs
Outweigh the risk. Okay. Okay. Well, I'm sorry, Jeff, we lost you. But if you want to call back, we can, get you on another time, Jeff. We talked about how do you pick a good surgeon? That's a tough question, because there's lots of surgeons out there, lots of different qualifications. But what are some things that you can give our listeners, some tips that might help them know that they're picking a good surgeon, or their general practitioner has picked a good surgeon for them?
Well, I think one of the ways, if you can get a hold of someone that works at the hospital, say, who would you have do your surgery?
Okay.
That would be one. And typically most of the nurses, especially if they work in the operating room or if they work on the surgical floor, would of course say, hey, these patients do well, or these patients don't do as well.
Okay.
Another one is, hopefully if you have a good relationship with your practitioner, and that practitioner is someone that you trust, which most patients do trust who they go see.
Good. Yeah.
It's whoever they recommend. There are websites that you can get on. There's several ones out there.
Now, you have to be careful with those.
Well, yeah.
I think.
Yes.
I think.
Because it depends. You may either get really biased, the person that really likes that surgeon, or you may get someone that really does not like that surgeon. And so, yes, you're not really sure what quality of information you're getting. But again, that's another source.
Right.
And you can look up, for us, we have the American College of Surgeons on their website, and you can see what their qualifications are.
Okay. Make sure they're boarded and went to school and all that.
I mean, I'd recommend board certification and make sure they're up to date, and that's going to become more public as time goes on about me as a surgeon of my good and my bad.
Okay, but I think out of all those you said, I think the word of mouth is
absolutely.
How was the outcome? I think that's very important. Hey, guess what? We have Jeff back on. Jeff, you're on with Dr. Wender. Go ahead with your question, Jeff.
Yes, I was supposed to have heart surgery 3.5 years ago. I had 3 arteries blocked to 70%, and they told me that due to my weight that they wouldn't do the heart surgery, and I was wondering if there was any other way of taking care of it.
Okay. Well, first let's talk about how weight increases the complications of surgery.
Well, one is putting more stress on your heart by far. Typically, the more weight, the higher chance you have diabetic complications, higher risk of blood clots, and also decreases your ability to heal. Unfortunately, fat tissue has probably one of the poorest blood supplies in the body, and especially any type of tissue where they have to cut your chest. If that gets infected, that could be a real problem, and when it is a problem, it's a real problem. So
try to get down to the ideal body weight.
Right.
So
I don't typically do that surgery, Jeff. I'm sorry. It's been a few years since I've been in that training. But I would try to do whatever they ask you, because that will typically really improve your outcome of your surgery.
Now, Jeff, as far as the blockages themselves, okay, if you can get the fat out of your body and fat out of your diet, that can slow the progression of your coronary disease, which would mean to eat a healthy diet, watch your cholesterol, do everything you can to be healthy. Remember, a lot of coronary disease is disease that we acquire by our lifestyle. And if we can live healthier lifestyles, hopefully you can do much better. And it sounds like if you do those things, you might slow the progression of disease, and you might lose enough weight. So if you did have a problem, the surgery might be able to be performed. So I would really work on those things. Try to get as much fat as your body at night. Eat less foods. Try to drink water at night. Get on an exercise program. Watch your cholesterol and make sure you're not a diabetic. All those things might help this disease not progress as quickly. Okay, Jeff. Good luck.
Okay.
Okay. Thanks for calling.
Thank you.
Dr. Wender, is there any patient that ever comes into your office and they need a surgery, and you just say, listen, I'm just sorry, you're just too heavy. I just can't do it?
Rarely.
Rarely. Okay. So in yours, it's a rare finding. Okay. So
it's not. We have patients that are heavy, but most times we can still do their surgery.
But it's always at a higher risk.
Oh, absolutely.
Yeah, so those out there, that's one that we talked earlier about, keys to successful surgery. Try to keep the body weight lower. That's going to make it a lot easier. Now, a lot of people are getting surgeries for extra weight. They get these liposuctions and weight loss surgeries and all sorts of things. What do you think about that? And you can be honest,
I'll just, again, I don't do that type of surgery. I'm very well aware of it, the bariatric surgery. I think for patients that maybe get so big that they can't exercise and they can't lose weight effectively, it's probably helpful because it does change diabetes and it does change high blood pressure. I think for those that still can be active and will take their time to change their lifestyle, I've seen several different people that were bigger and then you see them 6 months later and you say, what happened? And they said, well, I just didn't eat like I used to and I exercised. And then my thing is if you could do it naturally, that's the way I would go.
Okay, well, that's good. We're going to go to break right now, and Karen's going to be joining us after the break. 855-644-3278 is your number. Give us a call.
The Heart of Health Live will return in just a moment.
Could It Be This Simple changed my life. What an amazing and solid yet fulfilling and liberating message Dr. Jennings provides. I loved it.
It is liberating. It frees your mind from all your mental turmoil and teaches you what is really going on.
This book is amazing and makes so much sense. It shows God as a God of love rather than an arbitrary, exacting God.
I am so grateful that a friend suggested I read Could It Be This Simple? It has helped me fine-tune my thinking. This book not only helps the mind to heal, but helps to liberate the emotions by bringing them into balance. You will be captivated with the case studies liberally sprinkled throughout this small, easy-to-read book. I dare you to read it.
Get your copy of Could It Be This Simple? A biblical model for healing the mind at Amazon.com or wherever books are sold.
I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org. Hi, I'm Dr. James Marcum, speaker, director of Heartwise Ministries. And at Heartwise, our goal is to bring people into a relationship with the Heavenly Father using modern medicine and the healing principles found in the Bible. We teach people that there is a place for modern medicine and a healthy lifestyle, but it is in a relationship with their Creator where ultimate healing can occur. Over the past years, our ability to share this message of truth, love, and healing around the world has increased exponentially. But to continue this steady growth, we need your help. We are looking and praying for 100 individuals willing to give $1,000 a year. If the Spirit is moving you to become one of the Heartwise 100, won't you consider donating online today at heartwiseministries.org.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back to Heart of Health Live. We're with Dr. Eston Wender. He's a board-certified surgeon, and he operates and sees patients every day. He's more than qualified to answer your questions. I actually work with him, and I vouch for him. I would go to him if I was having a surgical problem, which I hope I don't. And I'm going to keep my weight off and eat healthy and exercise, so if I'm less likely to have a complication. We're up now with Karen. Karen, you're on with Dr. Wender. Go ahead with your question. Karen?
Yes. I've been told that I need knee replacement on one of my knees, and my doctor said there's 3 different forms of knee replacement. There's this one, and this one. And he said, and we do this one, which was the middle one, whatever that one was. So I was just wondering if you could give me some information on the benefits of the three major knee replacements and or the differences between them. I'm not in any pain right now, so even though he's willing to do it because the cartilage is gone, I'm still not in, excruciating pain.
Well, let me see if I can help you here. I'm a general surgeon. I don't do orthopedics, so I can tell you that most times. How old are you?
59.
59. You know, what I hear from people is a lot of people say don't do it until it's hurting.
Pretty bad, right?
Not till you're debilitated, but until the point it's really causing you some anguish, because it is a foreign body. There is risks of having it. There's a risk that if you live long enough that you may have to have it replaced. But again, honey, I am not an orthopedic surgeon, so I would probably not be the best person to answer which technique you should have done, and I'm sorry.
And second opinions are good, Karen. Another thing I like to tell patients in general is if I would get a second opinion almost on things that could go either way. But remember, there's many different surgeries that can be done, whether it be a knee replacement, which is sort of more invasive. Sometimes they can repair the cartilage by arthroscopic surgery. But it's also very important to understand, does it absolutely have to be done? Sometimes there's some things like you can rest and physical therapy and chondroitin sulfate. You might be able to put off the surgery for a while. And that's why a second opinion, second opinion by someone neutral, like even a family doctor that can sort of look at you. And then if you do need surgery, I would go and have the surgery done by a surgeon that does a lot of the surgery that he's comfortable with.
Exactly. If the doctor that you're seeing says, hey, this is the one that works best for me, then you know what, you probably should if you're going to let that doctor operate, let him do that technique, because that's the one they're going to do the best.
Okay. Well, those are just some.
That's what he does, a lot of that.
Yeah.
Well, I do have a second question. It relates to mammography versus thermography.
Okay.
I've had both. The last time I had a thermogram done, and I've noticed that there's doctors getting on board with thermography more and more. And anyway, a medical doctor read my thermography. Are you familiar with a thermogram?
I am not. We're not doing that up in Cleveland. I have not even read that in the journals, so that's something I need to look up, because we're not practicing that where I am.
Karen, right now the gold standard still is mammography. Even though they're doing more studies on thermograms, the gold study is still to get mammograms done, and if you have a suspicion lesion, get a biopsy. And I suppose you do a lot of biopsies on breast.
Do a lot of biopsies, yes.
Yeah, so but the mammograms are what the journals are recommending at this point. That could change in the future, but right now, mammograms for the early detection of breast cancer is the way to go. So.
Well, my sister-in-law had a mammogram last year, and just now she's had another one, and she has cancer, and it has actually spread.
That's right.
And it was just a very small little piece of cancer. So, from my understanding, a thermogram, which is a heat-sensing machine, that because cancer is very hot in nature, that it could have picked this up way before it actually spread. So, and the other thing is, we're kind of late in the United States, or I should say behind the times, as other countries like Europe are. And I just think when doctors have hundreds of thousands of dollars tied up in a mammogram machine, they don't want to invest in a newer piece of equipment like a thermography machine. And I wish you would do some research on it, because it's hard to find doctors that are more innovative, or keep reading up on the newer stuff that maybe?
Well, I'll tell you, Karen, right now the new stuff is genetic testing. And right now, if you have a strong family history and you want to detect cancer early, it's genetic testing. You don't want to find the cancer late. So, like I said, if you want to really, what's the hot thing right now in research is that if you're a high-risk group, you get genetic testing for the breast cancer gene. And if you have that, then you remember the mammograms and thermograms, once they find it, it's already there. It's detected it late. Any detection of cancer is late. Cancer sits in our body for a long time before it becomes activated. So the real cutting edge is not thermograms or mammograms, which might be able to detect it. The real cutting edge is going to be on the genetic testing, and that is available. So you might want to look in that, especially if you have a strong family history.
Yeah, you look for the BRCA. You can put that on the internet. That'll tell you everything you want to know.
But we'll, as cutting news comes out, Karen, we'll get it out here. But right now, we don't have any cutting studies that have been done on that. But right now, I definitely think if you're at a high risk, remember the thermograms and the mammograms detect it when I consider it too late. You want to detect it when it's early, even before it exists and grows to the breast. So thanks for your call, Karen. Appreciate it. Okay, next we have up is Laura. Laura, you're on with Dr. Winger. Go ahead, Laura.
Hello, sir. Mine is a heart question.
Okay.
I had a heart cath a couple years ago and was not able to return, but I did know, I know all my arteries are clogged, and including the one in my vein. And I was talking to my doctor, who is my new doctor, and was asking, also I've got spinal stenosis and bulging disc and arthritis, and a lot of stuff wrong with my back.
Uh-huh.
But also I was asking my doctor if I could maybe get a breast reduction so that would help some of the pain. And she told me no, and I said, why? And she said, Laura, you have heart trouble. And I said, okay, I understand this. And she said, your heart would probably not make it through the surgery. Mm-hmm. You probably would not come out of the anesthetic.
Okay. Laura, that's Laura, that's a great question, and many people have that problem of being high risk for any type of surgery. And I'm going to let Dr. Winger address the high risk and how he feels about operating on high risk people outside of this break. So stay with us. We have to go to break right now, and we're going to be right back and talk about this. And you can either stay on the line so Dr. Winger can talk to you, or you can hang up and you can listen. But we're going to talk about this after our break with Dr. Winger. He's a specialist in surgery. He's answering our questions here live on Heart of Health Live. Stay with us. We're going to be right back and answer this question.
The Heart of Health Live will return in just a moment.
I'd like to think that one day, when we get to heaven, we're going to see a list of people like Jared and Susan, who were introduced to Jesus because of something we said. Or maybe it was as simple as a passing smile. But these people will look into their past and be able to say, I'm here because of you. Recently, you may have heard that HeartWise Ministries has begun spreading the gospel to the young, the old, the sick, and the healthy using this very television program. But we need your help. We want to take this type of medical programming to the non-believer and the person who has closed themselves off to traditional forms of outreach. If you believe as we do and want to support HeartWise so that together we can count more names on the Tree of Life, please consider donating today at heartwiseministries.org. That's heartwiseministries.org.
Have you ever heard things about God that didn't make sense? Have you ever thought that science and Scripture cannot be reconciled? Have you heard ideas about God that scare you? Or are you just tired and confused? If you want answers to complex problems, If you want a testable, evidence-based understanding of God and the world around you, an understanding in which the Bible and science harmonize to reveal the reality that God is love all the time, then Come and Reason Ministries is for you. Hi, I'm Dr. Tim Jennings, board-certified psychiatrist, and Come and Reason Ministries is dedicated to helping you learn to discern, to stimulate you to think, to help hone and refine your ability to know the right from the wrong, the healthy from the unhealthy, and teach you how to experience healing of your mind, body, and relationships here and now. If you would like an evidence-based approach to knowing God, then visit us online at comeandreason.com.
The Celebration Cup is the sanitary and reverent way to celebrate communion, whether in personal devotion or with your church or other ministry group. Thousands of churches use the Celebration Cup regularly in their services, and it is perfect for ministries on the mission field, retirement centers, and other outreach ministries. You can order 100 Celebration Cups for only $25.97. Call 866-367-2877 or go to celebrationcups.com. When you call, ask about our free sample pack. Call now.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Dr. Wenger, Carol has called and she has lots of heart disease, wants to have a surgery. She was talking to you. What would you say to her?
I would say, Carol, if you have high risk, that means that doing your surgery, possibly when we put you to sleep, possibly when we wake you up, which are the two biggest stresses on your heart during surgery. Not the surgery itself, but actually going to sleep and waking up. And even in the post-operative period for the first 2 to 3 days, you're still at very high risk. And then even then at 30 days is your next level. And I would say as your surgeon, if this, I understand that this probably causes you pain, but I would have to say I don't typically do high-risk surgeries unless it means if I don't do the surgery that either you will either die from your disease, or you could potentially get much, much sicker, or that your disease is so bad that you cannot live your life as you would like to live. And then as long as you understand that by having the surgery you could pass away from having heart disease and having a heart attack, and you say, I understand that, doc, but I cannot live the way I am now, and I feel if you're an educated, understanding patient, then fine, I'll proceed with the surgery. We provide, as general surgeons, we provide high-risk surgeries all the time. We have to cover the emergency room, and anything and everything will come in. So I would just tell you, it just depends on how much this is bothering your back. If you would say, hey, I think this is what I need. I don't know that many plastic surgeons are in the way of doing high-risk surgery. So,
okay. Well, good luck, Carol, and we hope this all works out for you. Okay. Okay. I guess she hung up. Laura, you're on with Dr. Wenger. Laura, go ahead. Laura?
Okay, I'm so sorry. I didn't mean to interrupt. Yes, I'm here.
Go ahead, Laura.
My problem is this something that I should really start worrying about? Because I'll be 70 tomorrow. And if I cannot have surgery or, I mean, is this maybe life-threatening eventually? Am I really in that bad a shape that even going into surgery could maybe not come out of it?
Are you talking in regards to your heart?
Yes.
Yeah, well, unfortunately, unless something's done different to your heart, either a stent is placed or...
I've got angina.
Mm-hmm.
Yeah, if you told me you had active angina, I would say, I like you and I care about you and I'm not going to operate on you. Angina is a bad word in surgery. And I don't mean that in a mean way. I'm just saying that's a big red flag.
Okay, should I be concerned for my life period? I mean...
Well, yes, I would be. I would get with your doctors and see what can be done for your angina first, and then talk about the surgery second. So that's sort of what I do. Get working on the angina first, talk to your doctors what they can do to stabilize that, then talk to the surgeon after that's been stabilized.
Yes, because no one's going to take you to surgery until you have a quote-unquote blessing from your heart doctor.
Okay.
Okay, there's no way I would go to have any kind of surgery right now anyway, not with that standing
I agree.
in front of me. And,
okay. Well,
and I'm going to my heart doctor, the cardiologist, June, and then I'll, of course, discuss I had a heart cath.
Good.
And she said I had a bad heart, so that just kind of scared me.
Okay.
If maybe if I could do something different in my life, could maybe prolong it a little.
Yeah. Well, I'm sure they're going to talk to you about eating a diet and exercising what you can and putting you on the right medicines. So we wish you the best, okay? We're going to move to the next call, okay?
Thank you very much.
Okay.
You're welcome.
Laura, are you still with us? Laura. Oh, was that Laura that I just talked to? Okay. Lenora, you're on with Dr. Wenger, Lenora.
Yes, I am.
Go ahead.
2 years ago, when I was in the hospital, I was diagnosed with MRSA. Do I carry that for my lifetime?
Yes.
And how would that affect if I had to have surgery?
You would tell, that's an excellent question because you're one of many. And unfortunately, MRSA is not just for hospitals anymore. It's 70% of people out in the community. And it's important to understand, but it's not something I'd be scared about necessarily. But it's something that if you ever had to have surgery or a procedure or any type of surgery that required antibiotics, you would want to tell them that you have had a history of MRSA so that the antibiotics they would give you before the surgery would be there to cover for that particular bacterium.
So MRSA is an infection?
It's an infection, but we have bacteria all over our body. There's two ways about it. But that's why they typically will have you take special baths before your surgery to try to get rid of a lot of the bacteria. But unfortunately, once you've had it, the chance of you ever getting rid of it completely is low.
Okay.
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 Thank you.
You're very welcome.
Thank you.
Dr. Wenger, here's a call that's come into our website, and this person's had a lot of problems with their veins, a lot of problems with pain in their legs, swelling in their legs. What are some different surgical approaches to helping veins feel better?
That's a good question. Typically, if you come to see me and say, hey, my legs hurt, I have varicose veins, I stand on my legs all day, especially we have a lot of jobs that require standing around where we are.
It's becoming a bigger problem.
Yes. I stand on the concrete for 10 hours a day or 12 hours a day, or I'm a school teacher, or I've had 4 kids, or so on and so forth. Typically we'll have you get in those tight socks. But as far as procedures for those, we now can do most everything in the office. And essentially, there's, if you can call it a laser, which one is a laser, another one uses high frequency ultrasonic waves. But essentially, you essentially scar that vein down that's causing you the problem. And you can also remove those veins in the office with just very small little stab incisions.
Okay.
And then we also have medication you can inject into the veins. So the old fashioned of essentially stripping the whole vein out of your leg and leaving bruised and bleeding and sore and swollen, that's gone.
Now, how have your patients done with this so far? Have they found relief in their pain? Because that would be the main reason I go is for pain.
Absolutely, yeah. If people tell me, well, I don't like the way it looks, well, I say, well, that's cosmetic.
Right.
And you try to help them out to some extent. But for the patients that have big veins and you do the ultrasound is obviously abnormal. Yes, when you treat that vein, I've had people with these bluish purpley legs, feet. They've had it for years, and then you treat that bad vein, and oh my God, oh my goodness, it's pink again. So.
Okay, so there's something that can be done for that.
Absolutely.
Okay, great.
Absolutely.
Joe, you're on the line with Dr. Wenger. We have a couple minutes here before a break. So, Joe, what's your question?
Okay, it's about I have a hernia in the groin, and it's called inguinal hernia, I guess, right?
Groin hernia?
Inguinal?
Inguinal hernia? Yeah. Yes, inguinal.
Okay, so now it seems like it went into the scrotum. Is that normal?
That's where it goes. Yes, it's. When you're in mom, your testicle's in your belly, and as you grow inside your mom, your testicle goes out into your scrotum, and so if that area never closes all the way down, the hernia will follow that path, and that's why you find it in your scrotum. But yes, that's not. What's that?
How's the surgery done?
Surgery.
Oh, how's the surgery done? You can do it 2 ways. One is just doing an old-fashioned incision over the hernia area, and you put the sac, the hernia back down, and you close it with mesh. The other way is they can do it laparoscopically, where they put 3 holes in the lower part of your belly and essentially do the same thing, and then use a piece of mesh to close the hole completely, to secure it, to keep it from coming back.
I saw in the video they said sometimes they have to dissect part of the hernia sac or something like that.
Yeah, sometimes we cut the hernia sac. If it's big and redundant, we will cut it It doesn't mean anything to you. It just helps to decrease the chance of it coming back.
Oh, I see. And then they push everything back in.
Yes.
And then they put the thing in it. So do they usually put you out, or do they give you a local?
That's a good question. You can do it both ways. You could do it with, I've done it both ways. I've done it with people just with a little happy medicine and numbing medicine, or they can give you a spinal, or they can knock you out.
Okay, Joe, sounds like you're going to have a successful surgery, hopefully, and hope that answered your question. We're going to go to break. We're going to be right back with Dr. Wender answering a few more questions. Stay with us.
The Heart of Health Live will return in just a moment.
I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
Medicines That Kill from cardiologist Dr. James Marcum is now available. In his newest book, Dr. Marcum explains why he believes that medications may very well be the #1 cause of death in America. Medicines That Kill uncovers the hidden risks associated with modern pharmaceuticals and outlines the biblical plan for physical and spiritual health. To find out how to get your copy, visit our website at heartwiseministries.org or call us toll-free at 855-644-3278.
Hi, I'm Dr. James Marcum, speaker, director of Heartwise Ministries. And at Heartwise, our goal is to bring people into a relationship with the Heavenly Father using modern medicine and the healing principles found in the Bible. We teach people that there is a place for modern medicine and a healthy lifestyle, but it is in a relationship with their Creator where ultimate healing can occur. Over the past years, our ability to share this message of truth, love, and healing around the world has increased exponentially. But to continue this steady growth, we need your help. We are looking and praying for 100 individuals willing to give $1,000 a year. If the Spirit is moving you to become one of the Heartwise 100, won't you consider donating online today at heartwiseministries.org.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
We're in our last segment with Dr. Wender, and we have some more questions we want to get to, so we're going to try to go as quick as we can. Margaret, you're on with Dr. Wender. Go ahead, Margaret. Margaret?
Yes, I have 3 stents. Yes.
Okay.
Hello?
Go ahead, Margaret. We're listening.
I have 3 stents. I have 3 stents in my heart, 2 in my common iliacs, and 2 in my legs. All of these were placed through my groin where they went into my main artery of my leg. And I'm wondering if there's a limit to the amount of stents you can have placed, or does that artery become damaged, or is there going to be a point in time when they're not going to be able to get a stent in because of my heart attack?
That's a very good question. I'll address your legs. That's more what I do. Ideally, if you have a stent, if you smoke, stop. If you take your aspirin or Plavix or whatever your doctor has you on, if you're diabetic, control it. If you're high blood pressure, control it. If you're have high cholesterol, control it. That's the best thing you can do for your stents. In regards, how many stents can you have? You can have more. Eventually, putting more and more stents, you eventually will get to the point you cannot, because it'll just get either the size of the artery will get too small, or the stent can fracture. There's certainly really you can't put stents in your groin. because those will not work. And then the stents below your groin don't work nearly as well as the stents that would be up above your groin. And so for you, you just want to try to make your health, what's flowing through your blood, as clean as possible, because those stents can scar back down.
Yeah. So Margaret, I hope that helps.
I had one of my stents.
Yeah. Yeah, you know, remember the stents really don't fix the problem. They just treat a symptom. So, of course, if we live that healthy lifestyle, don't smoke, exercise, low-fat diet, that's going to be your best bet. Margaret, I'm going to have to cut you off because we're going to Brian. Brian, you're on with Dr. Wenger. Go ahead, Brian. Brian? Go ahead. You're on with Dr. Wenger.
Yes, sir.
Dr. Wenger.
Yes. Go ahead, Brian.
Yes, actually, me, I am an epileptic. So I wanted to know, is there any way whereby a surgery can be operated so that to fix my problem? Because I've tried a number of doctors. I do have a problem with this epilepsy.
You say blebs?
Epilepsy.
Epilepsy. Is there surgical approaches to epilepsy?
There are, and you would need to talk to your neurosurgeon wherever you live about having that fixed. But yes, there are portions of the brain that they know trigger seizures more than others, and sometimes if medication doesn't work, there are things they could do. They call it ablating, or going in and causing damage to certain parts of the brain on purpose so it does not hyperstimulate your brain.
Have you seen...
Actually, I've been having different medication for almost, it's almost 10 years now, but doesn't seem to solve the problem at all.
Yes,
Okay.
and that you'd have to see your neurologist or your neurosurgeon for.
Okay. Well, Brian, we wish you luck on this one, but go see a neurosurgeon, see if you might be a candidate for that surgical procedure. You know what? We're all out of time, Dr. Wenger.
Okay.
And I'm sorry, Lori from Texas, that we're not going to be able to get your call, but if you go to our website at heartwiseministries.org, we'll try to get them in the future. And all those that didn't get your questions answered, send it to our website. We're going to have Dr. Wenger on again someday. We'll collect your questions and answer all of them. So thanks for joining us. You've been watching Heart Health Live. Our website is heartwiseministries.org, and you can look up Dr. Wenger on the web if you're in the Chattanooga, Cleveland, Tennessee area. He'd be happy to see you in the office. So take care until next time.